You share with me what you know. I'm going to share with you what I know. And let's work together to figure out not only what we're going to do right in this moment, but maybe there's some things that this person can kind of tweak that'll do good for this pet and other pets down the road. And really trying to lean into the warmth and the empathy and allowing that to shape your conversation. I think everybody benefits, right? So, people appreciate it. You feel better about it because you get to have this warm, wonderful conversation. And it allows you to make recommendations that really are beneficial for both the owner and the animal.
Hi, guys, and welcome to the House Call Vet Cafe podcast. I'm Dr. Eve Harrison. I'm a full-time integrative concierge house call veterinarian in Los Angeles, and I help other vets to build their unique mobile practices on their terms. This podcast is for and by house call and mobile veterinarians, so it is meant to give our community a platform to connect, to share our stories, to lift each other up, and to support each other. Most of us work solo as lone wolves, right? So for me, it's been really powerful to be able to physically hear the voices of my colleagues from all over the world and to get a chance to feel that we truly are part of a community of very real other human beings who get it. While you may be alone in that little bubble of your own vehicle when you're on the road seeing patients, I welcome you to join our community by tuning into our own podcast when you're on your way to your next house call. Whether you're a super experienced house call vet with 30 years of experience, you're a brand new prospective house call vet just looking to get started, or you're house call curious, there will be something for you in this podcast. Each episode, you will hear interviews from other mobile veterinarians just like yourself who are doing unique and innovative things, vets who are sharing their stories, their struggles and challenges, and you can also look forward to hearing valuable information and perspectives from specialists and experts outside of our micro niche. And finally, if becoming a house call veterinarian is something that you've been thinking about exploring, or you're looking for some extra support getting your own mobile practice to feel more profitable and sustainable for you, check out the information in the show notes about my course and our above and beyond supportive private community for members only, plus our monthly group coaching sessions within the House Call Vet Academy. You can also check out my free public Facebook group, which is also called the House Call Vet Cafe, the same name as this podcast, and which is a warm and cozy community for mobile vets to support each other in professional and personal development, in creative entrepreneurship, and in friendship. So thank you guys for spending time with me today. Let's dive into the episode. Okay, everybody, I'm excited to welcome back Dr. Cassi Fleming for our part 2 episode. Dr. Cassi Fleming, if you haven't heard her first episode, is a triple Gator, earning her bachelor's and master's degrees in animal science, as well as her DVM degree from the University of Florida. Despite originally planning to enter dairy practice after vet school, Dr. Fleming unexpectedly found her calling in small animal general practice. While she still loves all things cows, she values greatly the close relationships she's formed with her clients and their beloved pets. Dr. Fleming worked as an associate veterinarian for the first 6 years of her career before making the transition to business owner and taking on her role as Dr. Cassi, staff veterinarian at NAVC's VetFolio. When not participating in continuing education through VetFolio, Dr. Fleming is the owner of Springs Veterinary Services, a small mobile general practice, and a part-time associate at Newberry Animal Hospital in Newberry, Florida, where she focuses primarily on dentistry in addition to general practice. Aside from dentistry, Dr. Fleming is passionate about arthritis management and fostering and protecting the human-animal bond. So welcome back, Dr. Cassi. I'm so glad you could come back and join me.
Yes, I'm so glad to be back, and I'm so happy to hear you call me Dr. Cassi because it was less weird hearing my bio read the second time through. But hearing myself called Dr. Fleming, I was like, man, not very many people call me that anymore.
I know, and we're like Dr. Harrison. I'm like, who the hell is that?
Yeah, so like when I'm in the clinic, people will call me Dr. Fleming, but even that feels a little bit weird sometimes. And then just like sitting here having a conversation, I was like, Doctor who? Oh, that's me. Okay.
Well, that's me. And it was kind of like a flashback. Every once in a while, like since becoming a house call vet, and I don't really go by Dr. Harrison anymore, it's like whenever it happens, it's like a flashback to like the first month after graduating from vet school. You're in the clinic and people are like, Dr. Harrison, Dr. What?
Dr. who?
That's
or like you have to sign your name and you're like, I'm signing this? Like my signature does something? What is this?
I know. It's like, I have the power. I have all the power.
It's such a weird feeling.
It really is. So how's your week in house call vet land been going? Any interesting stories from the week? I know you've been having kind of an overwhelming week from our brief conversation before hitting the record button. So what's the latest?
Yes. Oh my gosh. Yeah. Okay. So, first of all, we're talking on daylight savings. And ever since I passed the age of 35, I just like, I can't handle daylight savings. And it takes me 2 weeks to adjust. So, I feel slightly like a zombie in general. And then it's been quite the week from a house call standpoint and some ongoing cases. I had one patient who got an internal medicine consult and an abdominal ultrasound for now we're suspecting like a hiatal hernia. And so that was kind of an interesting collaboration. And then he actually ended up at a 24-hour facility for a different issue. And so it's been a lot of communication with that one. And then I have another one who I think has an adrenal tumor that's causing Cushing's.
Mm.
It's been exciting with some of the ongoing cases. But then add to that, my poor daughter has strep throat for the third time this school year. So, while it's been quite crazy trying to manage these ongoing cases, I'm so thankful to be a house call vet and make my own schedule and have that flexibility because I've been able to say, like, oh, shoot, I have to do some last minute rearranging and been able to do that for her.
Yeah. Yeah, I'm glad you have that flexibility right now. And I mean, I was thinking, I don't think I've ever had a hiatal hernia diagnosed. So that's kind of cool case there. And bummer about the adrenal tumor. Mm.
Yeah, I'm hoping both of these are gonna be positive outcomes. The hiatal hernia, I'm not totally sure going forward because it's brachycephalic and I'm a little bit scared of doing a barium swallow with him. So I'm kind of doing some surgical consults right now to see what that might involve. But the adrenal tumor, I'm really crossing my fingers that it will like declare itself as a true like cause of the Cushing's and maybe we can cure this dog. Fingers crossed. We'll see.
Amazing. Yeah, I fingers crossed right there with you. And so you're talking about like the barium study and the surgery and all that stuff. Is that going to happen at the clinic where you also work, or is that on your own?
Yeah, so I'm glad that you
Visits?
asked that. No, I would not be doing any of that in a house call setting. I have this, we talked about it in my bio, this kind of unique setup
Mhm.
where I work at a brick and mortar practice 1 day a week. And that started when I had just barely started my house call practice. I wasn't sure if I was even gonna keep it going for very long and, was kind of trying to find my way. I started working for this practice and they're just wonderful. And there's a lot of things that I don't like to do, surgery being one of them,
Mhm.
barium swallows and brachycephalics being another. And it's just been this really nice symbiotic relationship. For example, I have another patient who has entropion.
Mhm.
And, he's a big old lab. He's a big old goofball. And so the owner called me because he had a drippy eye. And so I went and I looked, and sure enough, he's got pretty bad entropion on the bottom lid. And so it was just really nice to be able to have the connections already in place and say, okay, I know exactly who to send you to because, well, sure, I'm probably perfectly capable of performing an entropion surgery. I just don't want to.
Dude, I get that to my core. I get that to my core. That's how I feel about surgery these days too. Like I can do all the
That
things.
makes me feel better. Like coming from you who started down a surgical residency, like that makes me feel so much better. I'm not the only one who's like, I just don't want to.
Dude, that is it right there. I just don't want to. I'm right there with you.
Now, teeth are a different story. Teeth are my jam. Like, that
You
is one
like
thing I love.
dentistry. Yeah.
Yes. When I'm working in the clinic, like, it's usually like every other week that I'll go in and I'll do a couple of dentals. And yeah, no, I love doing teeth, but opening body cavities or thing, nope, I'm good with all the rest of that.
I'm good.
Yep,
So you
I'll
like
pass.
doing the flaps and everything, like the
Yeah.
surgical extractions and all that.
I get so excited about them. Like, it's not like the flaps themselves. I mean, it's very satisfying when you're in there with an elevator and you feel that whole root come loose in one piece and you're like, yes, I got it. It's this beautiful flap. But more so, I think a lot of the reasons that house call medicine is so rewarding is it's the follow up. It's the 1 week recheck where they come back and they're like, I had no idea his mouth was in pain, and now, he's eating and drinking and all this, and that's really why I love it.
Oh man, that's so true. I mean, it's like every single patient that I send for a dental, like I'm not doing the dental, but I get to have the feedback.
Yes,
I
you get to do the follow-up.
I get to reap the benefits where they're like, "Oh, you're so right. He's so much better now. He's like a new dog." And I'm like,
Yeah,
"Told you
I told you
so."
you needed a dental.
I
It's
don't
so
tell them that, but
rewarding.
internally.
Yeah. Yes. Well, I guess, and like, I don't know, I feel like this added pressure when I'm the one doing it of like, okay, like, I made the decisions, I did the work, like, is it going to pay off? And so when they come back and they're like, they're so much better, I get so excited.
I totally hear that. So it's interesting how you have this sort of symbiotic relationship with the brick and mortar clinic where you work at. So you were telling me you work there 1 day a week. Is that right? And then the other days you do your house call practice and you don't have a mobile van or a clinic or anything. So that relationship with the clinic sounds really beneficial for you both because you can refer the surgeries, you can refer the x-rays, you can refer the dentals to yourself, right?
Yes. Yeah.
You actually do your own house call patients dentals at the clinic?
Oh, I do. And I have such anxiety every time I do it because I see primarily friends and family patients. But I really like when it comes to dentistry, when it comes to anything else, I'm happy to refer it out. But when it comes to dentistry, I'm like, no, as much as it gives me anxiety, I want to be the one who does it.
I totally get that. That's cool that you get to maintain the continuity of care for your house call patients and do their dentals, see them in the clinic, and then resume care for them in the homes. Pretty awesome.
Oh, it's been a really cool relationship. I've kind of gone back through and, examined it a few times and been like, okay, just really done a lot of reflecting on it. And I feel it's really beneficial for me. I think it's really beneficial for them. And it's a pretty big hospital. And so there's access to a lot of doctors with a lot of different skills and, even specialists and things like that. So it's just been very convenient. And it's also so nice to know when I do have to send these patients for something that I can't do, won't do, don't feel comfortable doing, or I'm just not good at. I know who I'm sending them to and I know what kind of care they're going to get and I can follow up and, it's just really nice rather than just not having that knowledge and that continuity.
Yeah, it sounds like a really nice support network that you have as well. Like you mentioned the other vets there and the specialists and it just sounds like just like you had said before we got on the call that it's the symbiotic relationship and I can really see that. That's just so cool. Can I ask, so in some states vets are required by their state veterinary boards to have a contract or like an actual agreement with a clinic where, for the things that they cannot provide. Is that something that you have, or is this more like a little bit more of an informal understanding that you've got each other's backs?
So, well, I guess it's the second one. I was going to say it's a little bit of both, but it's really the second one. So when I first started out, yes, Florida does require that I have a written contract with a brick and mortar who can provide the care that I can't.
Mhm.
So I reached out to the University of Florida when I first
Okay.
started because I didn't have a relationship with a clinic at that time that I, felt comfortable reaching out to. So my written agreement is with the University of Florida, but then we have this, then I have this handshake agreement where I'll refer to this clinic that I work for. And yeah, I never changed anything on paper, but a lot of my patients will go to the University of Florida for things too. So it works
Yeah.
out.
Yeah, thank you for sharing that. That's good to know. And there's just so many ways that we as house call vets can work with brick and mortar clinics that are either handshake or just an understanding. And sometimes it's a legal contract and things like that. For me, I have a rapport with a number of clinics where I've done relief work before. I'm not a regular, installment of their crew. I was at one point at some of these places before I got busy enough to not be able to do it anymore, but, kind of keeping a little bit of that connection, that rapport through occasional relief work when they're having a hard time, they need someone to cover. There's a vet that's, either sick or pregnant or whatever it is, and them knowing they can count on me, is just a beautiful way for me to know I can refer to them and vice versa. And so I think it's a really awesome thing to have a rapport like that, whether it's through a regular, once a week employment or relief work as needed. So I'm glad we got to explore that today because I do think it's a really important aspect of any successful house call practice that you do have some sort of connection and trusting relationship with a local brick and mortar or the local brick and mortars in your area. But it's really cool to kind of explore how you guys lean on each other a little bit. And you're certainly bringing them business, bringing in dentals. That's good business for them, big time.
Yes, I've thought about that. I'm like, okay, is this paying off for both of us? And I think the answer is yes.
Oh, yeah. I mean, you could just see it. It's like, they're like, "Sweet. This is a
Yeah.
great deal."
Yes, absolutely. And sometimes, I'll be honest, sometimes it works out even for little things. For example, I'm thinking of a lab patient that a colleague of mine spayed her, and she was also due for an influenza booster. And, if I think about the economics of it, for me to drive out and give an influenza booster, like, I'm not always making money on a call like that. And
Yeah.
so, that's another part of that symbiotic thing. Is I can be like, while you're here, let's just give this booster. Yeah, I lose the call, but I wasn't making money on that call anyway.
Yeah, and it's in the best interest of the patient and the client's time and money, and so I think
Exactly.
the
Yeah, they're not
win-win.
paying extra money just for me to drive out and give a shot that we could give, like, right there when she was in the clinic.
Totally. And so much props for you saying that just then because, I mean, we as business owners, it's so easy to fall into that trap of like, I must retain every sale. I must make every penny that possibly could be coming my way. And it's an easy temptation to not do the thing that is absolutely in the best interest of the client and the animal. And so I think having that sort of softness around that and like just letting things flow a little bit rather than like that rigid, I have to keep every penny from this life.
Right.
It's such a common thing, like, you see people really lose their mind over it when they become business owners, and so I think it's really admirable that you're, embracing the fact that, sometimes it's just in the best interest of everyone to kinda, like, go with the flow in that way. So
Yes, and I'm glad you did a much better job of summarizing that than I did. I'm sitting here going like, well, I that's not a profitable call for me anyway, but you're right. It's not just about me in that situation. It is about the client and about the patient. And yeah, why are we going to put everybody through a whole nother visit over something that's, can just be quickly taken care of right then and there. So thank you for taking what was in my brain and making it come out in words.
I mean, and the other thing to consider is that if it's not a profitable call for you, that's also valid. Like, I mean, it happens to be that it's, beneficial for both that you refer to yourself in the clinic. But, I mean, if something's not profitable for you or your business, that's also completely valid in and of itself. So just wanted to say that.
I appreciate that. I appreciate that. But you're right. It's so layered that, yeah, sometimes it just works out better for everybody that way.
Yeah, absolutely. So, one of the other things that you're passionate about, in addition to dentistry, is protecting the human animal bond. Can you tell me a little bit about that and how that sort of played out in the house call domain?
Oh, man. So I am very passionate about protecting the human animal bond, but I don't know that I've ever really like put it into words, at least not specifically my passion about the human animal bond. I think it comes out in practice when I'm seeing patients and it's like, okay, we want to handle them in a way that makes the owner comfortable, or we want to, I don't know, we want to keep the owner in mind when we're making treatment decisions and things along those lines. As far as it coming out on a house call basis, I guess you really get a lot of insight into the relationship between a pet owner and the pet when you do a house call visit. I mean, you see sides of the pet that I don't see when they come into the clinic, and it's nobody's fault. You can do all the fear-free things and do the absolute best that you can, but there are smells and there are sounds and there's other animals and things that stress them out that are just unavoidable. And so to see the side of those animals that comes out in a house call visit and that deep understanding you get between an owner and their pet, I think that's really special. And when we're talking about treatment plans, all right, this is where I'm trying to put this into words that make
Mhm.
sense. This is not going to be like anything groundbreaking to anyone. I think that many of us practice this way, but making those treatment plans with the owner in mind and the relationship that the owner has with that pet in mind. Maybe it's not I mean, to use an extreme example, maybe it's not a cut and dry euthanasia case, but if this owner elects to treat this pet, it's going to be financially burdensome. They're going to get frustrated with the pet because they can't get pills into them. And, by the time it is a cut and dry euthanasia case, everybody's going to be frustrated with everybody. And you lose that bond, you lose that warmth and that special relationship that they have. So that's kind of an extreme example. But even like I'm out in a fairly rural area. Sometimes I get asked to go and treat hunting dogs and hound dogs and things. And I guess, understanding that maybe I'm not going to get gold standard perfect everything for this patient, but let me do what good I can. And let me come at this from an educational standpoint where you share with me what you know. I'm going to share with you what I know. And let's work together to figure out not only what we're going to do right in this moment, but maybe there's some things that this person can kind of tweak that'll do good for this pet and other pets down the road. And really trying to lean into the warmth and the empathy and allowing that to shape your conversation. I think everybody benefits, right? So, people appreciate it. You feel better about it because you get to have this warm, wonderful conversation. And it allows you to make recommendations that really are beneficial for both the owner and the animal. It was really long and rambling. I don't know if any of that made sense. I hope
Oh, no,
so.
it completely 100% made sense. And I think what I'm hearing you say is that there's a little bit of a greater access to that concept of spectrum of care in house calls. That language has been coming up quite a bit lately, that there's not just one right way, that it's not black and white. There's a lot of opinion, emotion, frames of reference, and paradigms that are involved in these decisions that we make with our clients. And I think what I heard you say is that we can incorporate all of that into the spectrum of care that is all considered ethical and kind to the animal and the client. And I feel just even having this conversation is so important, just to acknowledge the fact that that should be a part of medicine in general. Like, I think we don't talk about it enough. We're just starting to talk about how the spectrum of care is a thing. It's a real thing. And it involves the client, and it involves their belief system and their financial status, and it involves them. It involves the other person. It's not just us talking at people, telling them, this is what I learned in vet school and what you have to do. And I feel like I heard you say that basically. And I feel, if I can add my opinion, is that when I'm sitting there having conversation with the client in their home, it all becomes so much more clear that this is a joint decision-making process. And there's two humans involved here or more, and an animal. And it's not just us, our brain, the books we've read, and what school tells us is the quote unquote gold standard. There's spectrum of care. And in the home, it's just so much more accessible. Would you say that that kind of sounds like your experience somewhat?
I would say that you're handling this time change way better than I am
Oh, for God's
because
sake.
you're able to say these things way more eloquently than what's coming out of my mouth. But
No.
yes, 100%. I love that you bring up spectrum of care because yes, I think that has a lot to do with it. And of course, on my podcast, I talk to a lot of specialists, and we're talking about different treatment plans and stuff like that. And I'm hearing it a lot from the specialist side too
Oh, yeah.
of treat the clinical signs, treat your patient, don't treat the numbers, which, we were always taught, but then it kind of got muddied in this whole gold standard, what do we do thing. So I love that we're coming back around a spectrum of care and this trusting yourself to make a good
Oh,
decision. Like that gut
yes.
instinct matters. And Eve, I've heard you in my head before when I'm like, oh, like I'm kind of going off my gut here. This is what I think. Like, when, you've said it's you and that animal and that person there, and, nobody else is there. Nobody knows what the right decision is right there, except for you and the owner and their pet. And so just trust your gut and go with it. I'm trying to think again. You once again said it more eloquently than I did when
Oh,
you
for
were on the
God's sake.
podcast. So it was when you came on the VetFolio podcast, and you were like, basically saying like, I think we were talking about not being. I don't want to use the word judgmental, but I don't have another word coming to mind right now.
Judgmental. That's a
Yeah,
good, but yeah.
yeah, don't be judgmental when you're looking at, records. And I think you were saying
Mhm.
like you weren't there. It was me and it was this pet and it was this owner and we made a decision together. And, so I've heard you in my head when I'm in those situations and it's like, we're the only ones here. And so we are together going to make the right decision for this pet. And I'm here to follow up if something goes sideways.
Absolutely. I love that. And I'm flattered that I have a little place in your mind when those situations come up. And I did want to, I'm like not sponsored by this company even a little bit, but I am right now drinking this thing called space tea, which is the quote unquote the world's first mushroom tea and lemonade brewed with reishi
Oh,
and lion's mane. So I might be having a little bit of extra brain boost right
oh, all right. I may need to look into that. You have like a little mushroom background too there. I love it.
powered by mushrooms.
Powered by mushrooms, not in this is like our vets behaving badly thing, like
Oh my
not what
God,
you
yes.
think.
Another way for us to behave badly. And we'll have
Yes,
to put the better name for that episode too.
I
So
love it.
I'm like something really naughty.
I know we're really getting on these topics here that could go so many different ways.
Seriously. But I mean, I just completely agree with you. And I think it makes me happy to hear that specialists are thinking of it that way too and are welcoming that sort of like big picture. Other people
Yes.
have opinions and
Yeah.
even expertise too. Can you imagine that? Someone other than a specialist might have expertise or a sense of judgment, like clinical judgment. And they might go with that decision.
Yes, uh-huh. Well, and some of what I've heard from the specialist side is some of the specialists having similar experiences of like, feeling like they need to euthanize an animal over numbers and,
Oh,
not wanting to do that because they're looking at this animal that's otherwise doing well, but the numbers don't make sense for how clinically well the patient's doing. And so I feel like some of what I'm hearing is coming from their experience of like, we don't want to put these animals down either. So
yeah.
you guys definitely shouldn't either. Let's nobody put them down. Let's just treat
Yeah.
our patients.
Yeah. Oh, we're opening a huge can of worms here around euthanasia, which is, I mean, it's the elephant in the room for every vet, for
Sure.
everything veterinary medicine. It's a huge frickin' mother effing
Yeah.
elephant that we all have like looming in every room. But I mean, you had mentioned one of your first examples of this preserving the human animal bond was the euthanasia that, maybe we pushed the animal too far, lost the human bond. Everyone's
Yeah.
miserable, including the animal. I mean, primarily the animal. That's the important thing, right? And so I'm curious, like, we all have these different sensibilities around euthanasia, and I have built up a whole like inner castle of how to handle all of this. And I'm certainly not right. I know my opinions are my opinions. And I've actually been changing over the course of the year. I've had a number of experiences that changed some things I've been thinking. But I'm curious, do you tend to lean as a result of this prioritizing the human animal bond, as you should? Do you tend to lean towards a quicker euthanasia or like earlier, or do you have a sense of like how you err on these issues, or is it just completely case by case for you?
Oh man, you're right. We are opening up a can of worms here.
Yeah. Yeah, that happened.
So, I will say I don't shy away from euthanasia. I think it's something very special that we're able to provide for our patients. I'm not a house call euthanasia vet, but I will go out and do house call euthanasias if it fits into the schedule and everything. And obviously, like, I do it for my patients. But personally, yes. And actually, that comes up in the exam room with clients when they're debating euthanasia. I'm going to give you a little insight into my relationship with my husband here, which we went way into on the last episode. So it
Yeah,
should be
why not?
nothing.
Keep on.
So I use him as an example when this comes up in the exam room or in the house call or something like that. Usually when it's a house call, we've been talking about this for a while, so I kind of have a sense of where the person is landing. But if this is maybe the first time that I'm weighing in on this, I'll tell him. And this is my personal opinion. And then I had another vet kind of explain this to me, and it made a lot of sense. Where I say there's generally, and again, this is my opinion, so nobody skewer me
First,
for this, but
first.
I say, there's two schools of thought on euthanasia, and neither one is right, neither one is wrong. And I say, and they're different person to person. And to give you an example, my husband and I feel differently about it. And we
Okay.
don't fall in the same camp. So for me, I fall in the camp of I would rather euthanize a little bit early and know that animal didn't suffer. And he falls in the camp of if they suffer for a day, at least I know I didn't do it too early. And at least I know it really was time. And, I tell people, I'm like, you might be one, you might be the other, you might fall somewhere in between. But regardless of how you feel about that, you're not wrong. And I'm here to support you in bringing about the best outcome for you and your pet. And so, if we're talking about euthanasia, if we need to keep treating because your gut tells you it's not time yet, that's okay. And if you're feeling like I know where this is going. This is torture watching my animal decline. I'd rather just go ahead and say today is time, then that's okay too.
Hmm.
And so I don't know if that, like I said, that's
Yeah.
my opinion. So hopefully, nobody skewer me for that one.
No, there's nothing to be skewered about that. I mean, I think what you said is absolutely right, that there is no right or wrong answer. I've been really leaning into this idea of, I obviously didn't come up with it. It's a philosophical concept of like kind of, what is the word I'm looking for? Like a non-binary answer to things. What is the word? Damn it. It's
Oh,
duality,
well, so
non-duality.
okay, yeah, non-duality. I also like false dichotomy. That's
Ah,
not
that's a good one too. Yeah, so false dichotomy, I like that a lot. And non-duality is the one that I had in my head, but there it's the same thing that it's like
mhm,
don't have to split. There is no right, there is no wrong. There's all this gray in between. And, we can hold one truth and simultaneously another truth. And, we alone can only take one of those actions, but they can both
right,
be true. And
right.
there's so much of that in what we do. And I mean, life, all of life is a giant exercise in non-duality,
Oh,
right?
and yeah, now we're getting into like meditation and like
Oh,
like
yeah.
now we could really go to
You want to go into existential topics? You got the right woman.
perfect. We'll be here all night.
Yeah.
Okay, this just turned into a
That's house call vets behaving badly, part 10.
yes, yes, exactly. It's gonna be a long one.
But I mean, it's just so true. And I think we need more of that non dichotomous thinking in veterinary medicine to hold the space for people who are maybe somewhere along, yet again, a spectrum of believing things. And I love also that you give people this example of like, I believe this. My husband, who's a person you love and trust and respect, believes this. And that's okay too. So you kind of thereby give people permission to feel something different than how you might feel. I think that's
Absolutely.
beautiful.
Or different from their spouse who's sitting
Mhm.
right next to them,
There
or,
you go.
somebody they love and trust. And, if they're not agreeing on it, to say, you don't have to agree on it. Now, we do have to make a decision on what we're going to do today,
Right.
but, you
Brava.
don't have to both be 100% in agreement that this was the right thing.
Brava. Yeah, no, I mean, that's so true. It gives them the permission not to agree with each other, which is probably, I mean, it's extremely common that people don't agree on these things. Like end of life
Yeah.
is one of the most potentially polarizing things that could ever exist. And so holding that space and giving people an example of like, you can believe this, you can believe this, that's all okay. And kind of moving from there. I think that's just awesome that you
Yeah.
say
We're
it that way.
talking literally about life and death. I mean, there's no rules when you get into that space.
Mm-hmm. Mm-hmm. Yeah, I love that. Thank you for sharing that kind of, language that you use to help people make those decisions. I think that's
Yeah,
really important.
I hope it, helps or, gives insight into some, if you get into a tough conversation, maybe it's something that can help there.
Yeah, I'm sure that's going to help a lot of our listeners. So thank you for sharing that. That's a gem right there.
Yeah, my pleasure.
Yeah. So moving away from the existential subjects and a little bit more into the concrete arthritis. You're really passionate about treating arthritis. Can you tell me a little bit about that and how you treat that in the home or share some kind of brain dump about arthritis or me?
Yes. Okay. Okay. Once again, like not thought through before this answer is coming out, but I think I can put this one into words a little bit easier. So I think one area of medicine that I really shine, and this is probably true for a lot of house call vets, is preventative care and client communication.
Hmm.
Uh, Managing arthritis is huge on both of those fronts. Like, we have to talk to people about their pet's weight from a very early age. We have to let them know, like, you have a lab, I have a lab. Like, this is coming. And so we need to be aware of this, and you need to know like measures that we can take preventatively and all this kind of stuff. And so I think it's a really good area for preventative care and client communication. But then also, gosh, like the new lease on life you can give to a dog who comes to you with debilitating arthritis. And, the owners are ready to call it quits at this point because they feel like their dog is suffering so much. And gosh, even if they're, you don't want to get into relying on NSAIDs or something like that at that point. I think when there's so many options that we have for arthritis management that make a huge difference, and you can make this really customizable plan for a pet owner and for a pet. And the results that you see are just so rewarding. And I think that when we're talking about this, we're able to offer a lot of encouragement to owners. It's not just like, give these meds, and if they don't work, then there's nothing we can do. Like, we can talk about the different joint supplements and how they work and, why this one might be better than that one in this situation. And fish oil and acupuncture and Adequan and laser and, of course, pain medications and things like that. And I think it really is an encouraging conversation in a lot of cases of like, there's a lot we can do here. We're not out of options.
Yeah.
And then when owners are compliant and they implement your plan and their dog is like, even if you just get them 6 more months, the quality that you can see,
Yes.
oh, it just warms my heart.
Oh my God, you're so right. It's such a big subject. Like every animal that we're gonna have is gonna, with any luck, if they make it to be an old animal, experience some arthritis, and there's so much we could do. I love that. And I mean, it's just literally like there's this, there's this, there's this, there's this, there's and you're absolutely right. Like when they're compliant, you get that win. You're like, yes, I
Yeah.
help the animal feel better. Hey, have
And you find your kind of spiel, your way of communicating that tells them all the options, but doesn't overwhelm them and which
Mhm.
ones to introduce first and which ones are most successful and get your experience with it that you can share. And it's such a fun conversation to just see them go from like, oh my gosh, my dog's in so much pain. What am I going to do? To like, oh, there's a lot we can do. Like we can really help my pet here.
Totally. Have you tried Solensia yet with any of your feline
Yeah.
patients?
Oh my gosh. Yes. Okay. Oh my gosh.
So
So, yeah,
good.
this episode not sponsored by Solensia.
I know. Right? However.
Yes. No. So I got to use Solensia on a compassionate use exemption before it became commercially available.
Oh,
I have
cool.
she's going to be 21 in June. 20-year-old cat patient who terrible arthritis, super goofy on gabapentin. Gabapentin didn't work for her. Like iris stage 3 kidney disease. Honestly, we stopped checking because they were just getting worse, but she's clinically doing fine. So we weren't going to treat the numbers. There's a
Right.
good example.
Right.
But last I checked, I think she was iris stage 3. She's hypertensive, which we now have managed. She's got a heart murmur, like all of these comorbidities. And I'm like, you want me to add a drug in on this patient? Are you serious?
Yeah.
And I did. She is like chasing laser pointers. She is jumping on and off the couch. I got that video and it was just like, I still like pull it up all the time. Like, you gotta see this. It was so exciting.
Oh, that makes me so happy.
Yeah.
So yeah, you
it's
guys
so
have been
good.
doing that. You guys, that cat has had that treatment for a lot longer than the rest of us have had access to it.
Yes, I think she's been on it for 7 months and it's been a game changer for her. Like I was amazed.
And you're doing it once a month for her, like routinely.
Yes. Yeah, we schedule the next appointment every time I leave and she tolerates it really well. I mean, she gets poked with fluids all the time, so needles are no big deal to her and she's a funny little orange cat. And yeah, we just go by once a month and do the injection and she's doing amazing. It really is like it's an amazing drug.
How long would you say that it took for you to see those changes or for the client to see those changes?
We saw noticeable changes within a couple of weeks. And then it was after the second injection that like the laser pointer came out and which, I know like cats and laser pointers, we're not supposed to do that, but it was still
Whatever.
exciting to see her too. Yeah. And the owner said they're like, we'll be watching TV and she'll come walk around in the living room where she never used to do that. And they think because they have a German Shepherd he's a really sweet boy and they get along. But they thought maybe she didn't feel like she could get away from him if he did come up to her, so she wouldn't come out of the bedroom, and then once she was being treated for her arthritis, all of a sudden, like, she'll come out because she's confident that, if it gets to be too much, she can walk away and get away from him.
Fantastic. Do you have any other favorite treatments for cats with DJD?
Ugh, no, I don't. Because
That's
they
the
almost
one.
all have
That's the
CKD
best.
too.
That's the
Yeah.
best.
Yeah, I mean, and of course, like, meloxicam is great if they can tolerate it. Onsior, so NSAIDs, sure, as long as they don't have kidney disease. Adequan, if you have a cat that'll tolerate it, I think can do really well. I really like fish oil for all of my patients. So yeah, different things, but I have not had as successful of a plan as I have with this one. It's been exciting.
I know. Like Solensia to me is like bam, that is the golden ticket right there.
Yes. Yes. It's been incredible.
Fantastic. So before we close up, is there anything else that you'd like folks to know about you? And how's your non-coffee drinking
Oh,
going? I know you're
wow.
not drinking coffee. How is that all going
Um,
now?
well, let me tell you, with the time change, yeah, those rules went out the window. But hopefully, like I'm a week into the time change, so hopefully, like after this next week, I can go back to following the rules. It's going okay. It's going, I feel like, about the same. I'm still like I've kind of developed this thing where I'm like, well, if I can't see the bottom of the cup before I refill it, it's the same cup, right?
Dude, there you go.
Technically, I didn't get a second cup of coffee there, but no, it's going okay. I appreciate you asking this. This is like an ongoing challenge for me.
I know.
Um, I got this stuff that it's like it's called Golden Mellow, and it's like a latte powder so I've been doing like almond milk and chai tea and this latte powder, and it's pretty good. Like it is manageable, but man, I miss the extra caffeine.
That sounds delicious, though.
Yeah,
Golden
good.
Mellow. I like
It's
it.
mushroom based, I
I
think.
bet it is. I was like, I knew it. It sounds like one of those mushroom things.
Yes, I think it's like some kind of mushroom. I should know this as I'm
And it's
drinking
racy.
it, but
Yeah.
yeah, and it's like it's yellow because it's got turmeric in it. And so it's kind of like it makes your tea look kind of fun because it's like neon yellow, and that makes me want to drink it a little bit more. It tastes pretty good. I really miss the caffeine.
Oh, I don't blame you one bit. Man. Well, thank you for sharing that. And thank you for your wisdom and, just for sharing your experiences. And I wish you the best of luck getting the time change under your belt and getting started.
It's really killing me. Can you tell?
You're doing great. Well,
Oh.
anyway, my dear, thank you again so much for joining me. And I look forward to our next chat.
Yes, me too. Thank you, Eve.
Thank you so much for listening to this episode of the House Call Vet Cafe. If you enjoyed this episode, then hit the subscribe or follow button on Apple Podcasts, Spotify, Google Podcasts, YouTube, or wherever you listen to podcasts so you never have to miss an episode. This podcast is made specifically for you, so don't be shy if you'd like to reach out and let me know your thoughts on this episode. You can find me on Instagram and Facebook as the House Call Vet Academy, where I also share more valuable content. If you're interested in learning more about consulting for House Call Vets or the House Call Vet Academy online course and community, please click on the link in the show notes. Have an amazing rest of your day, and I can't wait for you to join us for our next episode of the House Call Vet Cafe.
If you're looking for help with ultrasound scanning, check out First Opinion Veterinary Ultrasound for independent machine reviews and online and in-person teaching options. FOVU, simplifying ultrasound.